These are my 5 people in the audience. My orientation is a little off here. Okay. Smart device use and burnout among health education science educators. This is my table of contents. Things we will discuss are the purpose of this presentations, the methods we use, the results, discussion generated, and the conclusions drawn. Considering that consumer access to mobile technology essentially began in the 1982 with the introduction of the first mobile phone, the fact that there were 11 million cellular mobile subscribers in the United States alone by 1992 indicates growing consumer interest in technology. By 2001, subscriptions had increased from 4.3 per 100 inhabitants to 45 per 100 inhabitants, or that's roughly 128 million U.S. subscribers. In 2011, cellular telephone subscriptions were at a rate of 92.7% of the estimated 312 million U.S. population. This figure represents nearly 290 people and shows the depth of American interest in both the mobile and smart technology increasingly available to consumers since 2006. With today's increased dependency on the use of smart devices, lines are blurring between work and personal time, creating a pressure known as techno-stress. With the ambiguity of texting, social media, email, and distant education delivery in higher education, educators are not immune to this technological stress. Text and email messages can connect students with faculty 24 hours a day, 7 days a week. A study done by Franklin noted in 2011 that in the near future, all cell phones will be smartphones with internet access, and that smart devices have the potential to increase faculty's workload. With technology connecting educators to students and work during evenings and weekends, leisure time is disappearing and leading to a technological invasion of personal lives. Technological invasion is one source of techno-stress, which can lead to conflict between work and home and a feeling of work overload. Stress can result in adverse health effects, low productivity, and burnout in individuals. Burnout is the body's response to exposure of long periods of emotional and interpersonal stressors on the job, and is viewed as physical, emotional, and attitudinal exhaustion. The purpose of this study was to examine the perceived level of burnout of allied health faculty related to smart use device. An interdisciplinary health science research team was created to explore the overarching question: what is the level of stress and burnout among health science educators as a result of excessive connectivity to the workplace through smart devices? 4 disciplines were represented on this team: athletic training, nursing, radiologic sciences, and respiratory care. A demographic survey and 2 instruments, a health assessment and the Maslach Burnout Inventory Educator Survey, were administered to educations in the 4 disciplines. Now we'll talk about the methods. A literature review was done and conducted using the following search engines. Keywords and phrases also included these terms. With the exception of seminal work establishing a link between stress and burnout with smart device use and connectivity to work, only those research articles addressing the use of smart device and educator burnout were selected for review. A total of 27 articles were identified as relevant to the scope of this research. The definition of technostress has evolved since 1984 when clinical psychologist Craig Broad coined the term. He defined technostress as the inability of a person to adapt to the use of new technology in a healthy manner. In 1997, Will and Rosen stated that technostress is any negative impact on attitudes, thoughts, behaviors, or body physiology that is caused either directly or indirectly by technology. A study done also is quoted in the article, technostress is a problem caused by a person's inability to adapt to information and communication technologies. The author identified 5 sources of technostress, and they are techno overload, in which users work faster and longer. Techno invasion, a blurring between work and personal time. Techno complexity, users feel they have inadequate skills. And techno insecurity, users fear losing their jobs to information and communication technologies or more skilled individuals. And lastly, techno uncertainty, the continuous advancements in information and communication technologies. Technostress is a subdimension of stress. Extreme levels of technostress can result in health-related problems and burnout. Stress is the body's response to situations perceived as demanding or exceeding one's resources, and it can result in adverse health effects, low productivity, and burnout in individuals. Although a person may associate stress with work only, stress affects every aspect of an individual's personal and professional life, and the symptoms of stress, such as adverse health effects, low productivity, and burnout, do not differentiate spheres of an individual's life. Adverse effects that are commonly associated with it on a health scale are hypertension, headaches, heart disease, and gastrointestinal problems. Next, we'll talk about technological invasion. The use of smart devices has created a technological invasion into the personal lives. A technological invasion is blurring between work and personal time, creating a conflict between perceptions of work overload and the lines between work and non-work time. A review of the literature revealed no available research studies that examine the techno invasion of smart devices and burnout in allied health educators. However, there was a survey done of 661 individuals from a wide variety of industries. The top 6 industries involved in this study were education, healthcare, government, finance, retail, and manufacturing. The top 2 industries represented in the study were education with 17% and healthcare with 10%. The purpose of the study was to assess which of the characteristics of information and communication technologies contribute most to technostress. Results indicated that the strongest contributors to strain were role ambiguity or responding to constant demands, work overload or increased productivity with connectivity, followed by conflict between work and home, or time spent at work, on work at home. And lastly, job insecurity or the resistance to technological change. The results of this study suggest one key important fact, that stress can affect employees' work and that technostress is real. And organizations need to be aware of how the stress can affect employees' work. There are 7 consequences significantly associated with technostress, and they are intensified role conflict, in which office hours were extended and created a work environment that was too difficult. Increased role conflict. Office hours were extended and created a work-home conflict, which is working rather than going home and participating in personal and life activities. Reduced job satisfaction. Individuals who experienced technostress were more likely to have a negative perception of their job. There was decreased innovation with the use of information and communication, decreased productivity, increased satisfaction or dissatisfaction with information and communication technology use, and reduced organizational commitment. The research revealed key factors that create technostress and the negative effect it has on individuals and organizations. There is, however, a research gap that exists between the technological invasion of smart devices and burnout of allied health professionals. As noted earlier, most existing investigations focus on educators' technostress levels with using technology. So this research that was done with this particular article appears to be the first of its kind. So now we'll talk about the methods. An interdisciplinary health science research team was created to investigate the overarching question: what is the level of stress and burnout among healthcare science educators as a result to excessive connectivity to the workplace via smart devices? A survey research design was used that incorporated 2 validated instruments. 4 disciplines were represented on this team: athletic training, nursing, radiologic sciences, and respiratory care. Approval was obtained from Midwestern State University Institutional Review Board, and 3 sections actually made up the survey used in this study. The research team created the demographic and smart device use sections based on literature review and added the Maslach Burnout Inventory Educator Survey. That particular inventory survey is a leading survey for measuring burnout and is designed to assess the 3 aspects of the burnout syndrome: emotional exhaustion, depersonalization, and lack of personal accomplishment. A stress and burnout health assessment questionnaire validated in a previous study was also used or included to capture adverse effects health data. The survey instruments were then converted to electronic form for delivery via SurveyMonkey. A list of accredited programs in the United States were obtained for these particular departments, and the list only identified program directors and their email addresses. So in order to reach all the educators, an email was sent to the program director, who then was forwarded on to any other educator in their particular department. These are the results. I actually have the first set of results here that I pulled directly from the article that I'll bring up here. So as you can see on the screen, we have figure 1. Initially, about 2,392 surveys were sent to program directors, and who were then forwarded on to the additional. So it was a total of about 2,750 surveys. A total of 977 were complete with a response rate of 36%. And the first one shows by discipline how many actually return and what percentage of each discipline made up the survey. So as you can see here, those are their results between the 4 disciplines. Then figure 2 represents the full distribution by job position itself, as you can see. Figure 3 represents the distribution by employment setting, educational level. And figure 4 is by educational levels, I'm sorry. So approximately 50% of the respondents were aged older than 50 years. 44% were between 31 and 50, and 4.7% were younger than 31. Nearly 50% had 10 years of teaching experience or less. 25.3% had 11 to 20 years, and 25.7% had 20 years or more. The level of stress and burnout among health science educators as a result of excessive connectivity to the workplace through smart devices is addressed in the following analysis. The number of times a smart device is used per day is as follows. 44.2% report using it 1 to 15 times. 32.8% report using it 16 to 30 times. 9.5% report using their devices 31 to 45 minutes, and 12.9% report using their device 46 times or more. 70% of the smartphone devices used currently are between 6 a.m. and 6 p.m., followed by 30% between 6 p.m. and 12 a.m. For the sake of time, we'll go ahead to the discussion. Okay, so the purpose of this study was basically to again perceive the level of burnout of allied health faculty. The null hypothesis was this: that there were no statistically significant effects of increased connectivity factored by age, sex, educational level, number of years worked, and number of hours connected, or burnout scores as measured by the Maslach burnout inventory. Based on these findings, ultimately the null hypothesis was rejected. In this study, the participants had considerably high emotional levels. Some of the pluses were that the results indicated that they strongly felt need to be connected to their workplace all hours of the day. This implies that healthy boundaries are created for smart device use for work purposes after hours. Emotional exhaustion can be minimized. The significant differences in emotional exhaustion and depersonalization scores by profession could be attributed to teaching styles or nature of the program levels. It is also interesting that 7.5% of the respondents reported anxiety, 12.1% of those having difficulty sleeping, and 12.6% of those reporting chronic headaches. But because of a family history, the same symptoms also was indicated. A causal relationship between work connectedness and health issues cannot be established. It is possible that family history increases acceptability to these health issues, and work connectedness provides a trigger. No matter the case, this is a self-reported perception. The other limitations of this study included the two-step process to distribute the survey to as many faculty as possible. And furthermore, much of the data was self-reported, and this must be taken into consideration when generalizing other settings or populations. So in conclusion, the primary focus of this study was to determine the presence and effects of smart device use in connection with this workplace and burnout. Our findings indicate that emotional exhaustion occurs when healthy boundaries are not set for smart device use for work purposes after hours. Our findings regarding burnout and perceived health problems could be identifying the work overload and work-home conflicts identified in other studies discussed in the literature review. There are many advantages to smart devices, but healthy boundaries must be set for their use. Future research should include further investigation of educator burnout related to smart device use to include a large sample size and additional allied health disciplines. In addition, health education and intervention programs should be created to educate faculty, increase awareness, and help set boundaries for smart device use after hours for work purposes. Thank you. Any questions?